Hello everybody, my name is Medical101 and welcome to lesson 5 of Dentistry101 as a part of Medical101, some common dental procedures in a dental office. As always, be sure to take notes if you would like. Please be sure to check out the disclaimer as that's very important. And yeah, let's just begin. Just get your stuff assembled, let's begin. Okay, first, teeth cleaning. So first I'd like to mention that my source for my image and information is healthline.com. So a teeth cleaning, we know what they are. There's the routine cleaning we do every few months at the dental office. But how does it work? So before the actual cleaning begins, they do a physical exam of your entire mouth. The hygienist uses a small mirror to check around your teeth and gum for any signs of gingivitis or any potential concerns. If there's anything major, the dental hygienist might call the dentist to make sure it's fine to proceed. If everything's good, then they'll start by removing plaque and tartar. So the dental hygienist uses a scaler to get rid of plaque and tartar around the gum line as well as in between your teeth. So the more tartar there is in your mouth, the more time they may need to scrape up a particular spot. And then brushing and flossing stops tartar from building up and hardening into. Brushing and flossing stops plaque from building up and hardening into tartar. Once you have tartar, you can only have it removed at your dental office. So this is your least favorite part of the teeth cleaning process. The lesson is to brush and floss more often. And now a gritty toothpaste. So they're professional cleaning toothpaste that are just like regular toothpaste, but they're much stronger and they're deemed safe to use twice a year. But they're quite harsh and shouldn't be used too often as they'll wear down your enamel. So there's a gritty toothpaste used. Then expert flossing. So the dental hygienist can get deep between your teeth and locate any potential trouble spots where you might bleed at the gums. This might seem pointless at home if you floss, but having a professional floss at your teeth also removes any leftover plaque or toothpaste from earlier in the cleaning process. Then your mouth gets rinsed and they apply a fluoride treatment, so which helps provide protectant for your teeth to help fight against cavities for several months. They may even ask you what flavor you like. They'll place the foamy gel into a mouthpiece that fits over your teeth and is usually there for 1 minute. So varnish can also be painted into your teeth with a small brush and will harden when in contact with saliva, so you can eat and drink immediately afterwards. So these are typically done twice a year, so yeah, maybe just take a few notes, be sure. And again, my source for this is healthline.com. Next, dental fillings. So my image and source info is buckheaddentistry.com. So a tooth filling is dentists use these to treat small holes in cavities, extract cavities that decay, and fill the space with filling material. So just maybe be sure to write that down. So you know you need a tooth filling if you have dark spots in your teeth, a hole that you can always see or feel in your teeth, food that always gets stuck in your teeth, when your floss tears in a certain spot, a rough, chipped, or broken tooth, and broken or lost filling for teeth. So you need a tooth filling. So tooth fillings help repair cavities, but so they don't become bigger dental problems down the road. They can fill small holes caused by tooth decay, but can also repair cracks and fractures in teeth. So tooth decay can become a serious problem, but tooth fillings are also very essential. So, yeah. Now, dental extractions. So the area of that tooth gets local anesthesia. The tooth may get loosened by an elevator, and then forceps will be used to remove the tooth from the gum. So my source for this information is mountsinaihealth.org. And my image source is absboston.com. So the tooth extraction is a procedure to remove a tooth from the gum socket, usually done by general dentist, oral surgeon, or periodontist. So let's say, and these are just for basic tooth extractions, but let's say yours is more complex. So you'll be given a sedation so you feel relaxed and asleep, as well as an anesthetic so you're pain-free. The surgeon may then need to remove several teeth using some methods, and then for an impacted tooth, the surgeon may also have to cut a flap of gum tissue and remove some surrounding bone. The tooth will be removed with forceps. If it is hard to remove, the tooth may be sectioned into pieces or broken. So after the tooth is removed, your dentist will clean out the gum socket and smooth out the bone that is left. The gum may need to be closed with one or more stitches, also called sutures, and they'll be asked to bite down on a damp piece of gauze to stop the bleeding. So this procedure, dental extractions are usually done due to overcrowding or poorly positioned teeth, gum disease, tooth injury from a trauma, impacted teeth that are causing problems such as wisdom teeth or third molars, or a deep infection in a tooth called abscess. So these, though they aren't that important, there's a lot of things that can happen if you don't do dental extraction, including but not limited to infection, nerve damage, fractures cause. Actually, no, I apologize. There's a lot of problems and risks that can occur during a dental extraction, which you might have to be aware of. So, incomplete relief of plain discomfort or pain at the injection site, bruising or swelling, damage to the teeth or restoration, nerve damage and infection. However, these are quite rare, aside from a bit of pain. But aside from that, these are quite safe and common procedures in the dental office. And after the procedure, your lips and cheeks may be numb, but they'll wear off in a few hours. And you might be also given an ice pack for your cheek areas to help keep swelling down. And then, if you feel a bit of pain, you can take a painkiller such as ibuprofen, Motrin, Advil, or maybe prescription if it's quite severe. So my information source is mountsinai.org, and then my image source is absboston.com. Now, dental veneers. So dental veneers are custom-made shells that fit over the front tooth of the surf of your teeth. They conceal cracks, chips, stains, and other cosmetic imperfections. And my source was at the Cleveland Clinic. And then let's look at this image. So this is how a smile looks originally before a treatment. They have uneven a smile line, so we can see here. And then one of the first steps in creating a new veneer is selecting a prep shade. So for the teeth, and then the doctor works along a lab technician to color and shape the new veneer. They fit the veneer into the mold of our teeth to assure the correct fit. And then they're fitted with a temporary set of veneers while they finish the final set. And then voila, a new smile. Your smile looks great from all angles. And then this is the number of the website of Cleveland, that from here, Grace Sun, from sundds.com. So this quote is cited by Cleveland Clinic, and then this image, our steps-by-step process of a dental veneer for dental imperfections, is by sundds.com. Now, braces. So braces are probably a very common one that everyone's aware of, and they correct a wide range of dental issues, including cracked, crooked, gapped, rotated, or crowded teeth. So there's my source for this also, Cleveland Clinic. So it's done by orthodontists, and then process typically ranges from 12 to 36 months. And then braces cost from 3,000 to 10,000 depending on length and severity without insurance. So my source for that is Oral-B. And then a retainer is worn after braces treatment. So braces are can be covered by insurance, but they're typically very pricey if you don't do so. But they are quite useful and stay permanent, given that you wear a retainer after braces treatment. Now, so this is the step-by-step process of braces. So my source for this is also Oral-B. So step 1, your teeth are cleaned thoroughly. Step 2, the bonding glue is applied. Step 3, the actual brackets are attached. And then the arch wire is placed through the brackets, and then an arch wire is secured with elastic band. So maybe you know someone who has braces who has completed this process also. For example, me, I also currently have braces right now, and I can relate to this process. In fact, it took me around 2 hours to do so, and it isn't very painful at all, or if any. Just might feel a bit uncomfortable as they put the mouth holders in and the glue, as you're not allowed to put your tongue on any of your teeth surfaces. And then the next one to be aware of is a root canal. So my image source is FitzgeraldDentistry.com. So a root canal is done when in the inside of a tooth gets inflamed or infective, and can happen for multiple reasons, such as a chipped or cracked tooth or deep decay. So it's also known as an endodontic treatment to remove the infected pulp to save your damaged or infected teeth. That's how it's performed. So first you have to diagnose the infected pulp. So you may take a couple x-rays to do so, a sensitivity test to see whether your biting surfaces what happens when your biting surfaces come in contact with sweet, cold, or hot stimuli. So then your general medical practitioner will send you to an experienced dentist once he has identified the problem causing toothache, because they require advanced technology to understand the situation entirely. And endodontics will then use advanced x-rays and digital imaging to confirm the need for a tooth canal. Using a needle, the dentist will use local anesthesia to numb the tooth and surrounding tissues. If your pulp is inflated, it may take some time for it to get numbed, but your endodontic will not start the procedure until it is. After local anesthesia numbs your tooth, the dentist may put on a dental dam, a small rubber-like material that separates the infected teeth to keep them dry and clean. The sheet of rubber substance isolates the teeth that needs root canal treatment by covering other teeth in your mouth. So then they remove the infected pulp inside the tooth when the dentist drills a hole on the top of the tooth to eliminate the bacteria and the pulp. So help your dentist to access the pulp changers and roots inside of the tooth. They will then use surgical tools to clean up root canals, the pulp chamber, and possibly apply antiseptic or antibiotics to ensure no infection is left to cause pain. And then they insert the files of varying diameters into the holes and to reach the root tip and remove the infected root canals altogether. Your dentist will then use sodium hypochlorite or water to get rid of any leftover bacteria. The pulp was already dead, so getting rid of it won't cause any harm to the tooth. So then once it's thoroughly clean and dried, the dentist will use a material called gutta percha, rubber-like material, to fill the canal. It is placed inside the canals and later heated. The dentist compresses it to help fit against the walls, and then an extra endodontist will add an adhesive cement to seal the canals adequately. A properly sealed canal will help keep bacteria away. And then after a few weeks, you'll need to book an appointment with an experienced dentist to remove the temporary filling in the tooth. The dentist will then make a permanent filling over the treated tooth, making your teeth as strong as it was before it got infected. This not only serves as a restoration to your affected tooth, but also prevents further infection. So that was a lot, and I understand that was really hectic and hard to memorize. So as always, if that was a lot or something, you can always refer back to this site. And if there's no, it's not entirely necessary to take notes, but it is good for general knowledge. And this was a diagram by the same source for the step-by-step process of a root canal. So we'll just take a minute to get this down. And now finally, teeth whitening. So teeth whitening lighten the color of your teeth and remove stains. So my source for this is WebMD. And my image source is Healthy Smiles Dental Group. So this is quite an extreme case, obviously, but it's a before versus after of extremely yellow teeth to extremely white teeth. So looking at the WebMD source, teeth whitening is a procedure to lighten the color of your teeth and remove stains. You can do it at your dental office or at yourself at home. So now I'm going to be reading off the website. So it's most often done using peroxide-based bleaching agents, at home containing 3 to 20% peroxide. In office systems contain 15 to 43% peroxide. So generally, the stronger the solution, the longer you keep it on your teeth, the whiter your teeth become. So there are two terms for this, whitening and bleaching. So teeth whitening can be done with either bleaching or non-bleaching products. Bleaching is a type of whitener that involves using bleach containing peroxide. It cleans both deep and surface stains that can make teeth even whiter than their natural shade. So yeah, just very simple. The process of teeth whitening is just done by bleach. And let's see if there's anything. So there's also at-home options as well, such as tooth whitening strips, which can cost from $10 to $55, significantly cheaper. And then there's the dentist ones can range from $150 to $600 with tray-based tooth bleaching solutions. Tooth whitening, toothpaste are also very helpful, but they aren't as strong and they're relatively inexpensive. So and they aren't left on the teeth long enough to have a strong whitening benefit, however. And then there's also such thing as whitening chewing gum, which you chew to help prevent stains after you use substances that stain your teeth, such as tobacco, coffee, or tea. And then to keep your teeth white, which is just a quick tip, you can avoid acidic foods and beverages. Those are rich in tannins, substances found in plants that have an astringent quality, and deeply colored ones that can stain your teeth, such as black teas and coffee, white and red wines, sport drinks, carbonated beverages, intensely colored foods like blueberries, and sauces such as soy, tomato, curries. And some carbonated beverage examples include dark and light colored sodas. And yeah, teeth whitening is generally safe, but if you do it overly aggressively, it can cause gum irritation, increased tooth sensitivity, softening of the tooth's enamel, roughening of the teeth surfaces, and damage to or discoloration of dental restoration like crowns. So yeah, So that's the conclusion of lesson 5 of Medical 101 for dentistry, some common dental procedures in a dental office. As always, be sure to check out all the sources cited, the disclaimer, and yeah, thank you for watching.